A hybrid OR is a specialized room that allows the surgeons, in our case, the vascular surgeons, the cardiologists, as well as the heart surgeons, to be able to not only operate and use our surgical skills, but also be able to do procedures and repairs of the cardiovascular system using minimally invasive techniques with X-ray. So a hybrid environment, by definition, is much bigger, has a lot more equipment, allows us to bring our surgical instruments as well as our endovascular instruments that you don't necessarily see in a standard operating room or in a standard angiography room.
So for the hybrid OR, you're going to be doing higher risk and generally larger access type procedures. And so when we're giving you either a repair or a replacement of either your aortic or mitral valves, the catheter, the size of the tube that we need to use in order to be able to do that is large. The larger the access point, the higher the risk for bleeding or damage to the blood vessel. And so those are the procedures that carry higher risk, and that's why you want to be in the hybrid OR for those procedures. So people that need structural procedures, as particularly valvular heart disease structural procedures, need to be done in the hybrid OR for patient safety and to optimize outcomes. Sometimes structural cases turn into operative cases if there's a complication, and being able to do that in an actual operating room sized space is, critically important to patient care and patient safety. And so when there is a hairy moment, you want to be in a place that's designed to best be able to handle that, and that's what a hybrid OR is.
We can do CAT scans on patients in that type of room and immediately see the results of our repair. That's one added benefit to a hybrid environment that you don't necessarily see in a standard operating room or in a standard angiography room. This way we can map out important arteries, and we don't need to do that at the time of surgery. That's all done from the patient's CAT scan and then fused to the patient through advanced computer technology and AI technology that these devices have now.
State-of-the-art care, which I think we've been doing, but in a state-of-the-art place, in state-of-the-art facilities. So that's very exciting, and they kind of go together and go hand in hand. So delivering high-quality, cutting-edge medicine, you want to be able to do that in a brand new cutting-edge space. All of our patients to come for the various cardiac treatments and modalities that we offer is super important and exciting.
What excites me most about the new tower opening up is how we can be laser focused on cardiovascular care all in one spot. When these disciplines that share these types of patients with regards to their diseases and comorbidities, having them together, having them aligned, having them physically in one space is incredibly helpful in our collaborative efforts with taking care of the whole patient. I can't think of another spot where you can really provide this whole person care when it comes to cardiovascular disease.